In this video, I'm going to go over what is degenerative disc disease, its causes, symptoms, and give treatment tips that does not include risky drugs or surgery. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. To begin with, let's start with the location of where degeneration takes place, the spinal discs. The spinal discs are soft, shock-absorbing cushions of the spine that fit between the vertebra, or bony segments that make up the spine. They aid in movement to help your back stay flexible so you can bend and twist. They have two main parts, a soft inner core called the nucleus pulposus and a tough outer wall called the annulus fibrosus. So degenerative disc disease involves the breakdown or deterioration of a spinal disc. So what's the most common cause of this? Is it an injury, an accident, or a fall? Actually none. No, it's actually just from the normal process of aging. We just simply wear out over time. When we are born, spinal discs are primarily composed of water, roughly 80%. As we age though, water gradually leaves the disc and they start to dry out. This causes spinal discs to have less shock absorbing abilities and leads to less cushion between the joints. Other causes can be linked to wear and tear on our bodies from strenuous activities like sports and labor-intensive work duties. But even daily activities like bending, lifting, and twisting will start to add up. And of course, injuries and accidents, especially if not treated properly, may lead to damaged discs that progress into degenerated discs. The majority of people by the age of 60 will have some amount of disc degeneration, even if they're not experiencing neck or back pain. I also want to note that this is not a fast process by any means. It could take several years, even decades, before symptoms are experienced. To dive deeper, let's take a look at the progression of degenerative disc disease in 3 phases and the associated symptoms that may be experienced at each stage. The early first stage is called dysfunction. This phase is like having a locked, rusty hinge in one of your spinal joints due to the disc wearing out. Your joints, disc, nerves, and posture are stressed and begin to age more quickly. The joints won't move as easy as they once did, and there may even be a loss of normal spinal curves. Common symptoms that might be noticed may include pain that is worse when sitting. This is because while seated, the discs of the lower back can have up to 3 times more pressure and load on them than when you're standing. Back pain that gets worse while bending, lifting, or twisting. Moving usually makes you feel better, especially while walking or doing light activity. Inactivity does the opposite, so sitting or standing for long periods of time will make you feel worse. Changing positions often or laying down gives pain relief. Surprisingly though, at this stage, there may be no pain experienced at all other than occasional discomfort. Some people may just experience a slight lessening of energy and height loss. The second phase is called instability. Just like the name implies, there's a much greater degree of joint decay and disc narrowing. Bone spurs or osteophytes begin to form. Postural changes are much more noticeable, and other issues like spinal canal narrowing, known as spinal stenosis, may occur that lead to nerve pinches. This phase is characterized by more frequent aches and pains, fatigue, and a lessened ability to deal with everyday stress. Periods of nagging to severe pain lasting from a couple days to months may come and go. Pain may be felt from the neck to the low back, buttocks, and thighs. In more severe cases that involve spinal stenosis, nerve pinching may occur that leads to radiating pains, numbness, tingling, and weakness into the arms and legs. Also at this point, decreasing height becomes more noticeable. There's just less cushion in between those joints. Last is the stabilization phase, where most joint space is lost and is bone on bone. Being the most advanced stage of degeneration, posture changes are severe and back or neck range of motion can be very limited. There can be extensive nerve damage, permanent scar tissue, and bone spurs may grow so large that they begin to fuse with each other. Individuals may experience frequent to constant severe pain, various degrees of physical disability, and continued loss of energy and height. Unfortunately, at this stage, it is considered irreversible. Like any condition, treating it in its early stages usually will lead to a better outcome. In the first phase, conservative treatments such as chiropractic care, spinal decompression therapy, and physical therapy may help reduce the frequency and intensity of the symptoms. A lot of people have gotten significant, long-lasting relief from these treatments. As it progresses into the later stages, the degree in which someone may get relief will lessen. Treatments usually will become more invasive to include pain management through medications and injections, possibly surgery if it's severe enough. That's why it's important to treat it as soon as possible. Again, treat it as soon as possible. So I hope you found this video helpful and it helped answer a lot of questions. If you do have any other questions though or comments, please leave them below and I'll get back to you as soon as I can. And if you are in the St. Joseph, Michigan area and are looking for back or neck pain relief, especially if it's being caused from degenerative disc disease, please get in touch with us. We offer non-surgical chiropractic and spinal decompression treatment options to help reduce the pain and discomfort caused by this condition. You don't need to sit and passively watch your neck or back pain get worse. Call us today and take one step towards better health. Thank you for watching.